know this is a follow-up to a lot of people who have purchased a laser. Congratulations on that. That's fantastic. I'm so excited. I'm happy that you're imbued with enthusiasm on how to use this and integrate that. So I'm going to show you. I just want to review. I got my little whiteboard right over here, and I want to go over a few basic concepts. This is for you guys. Let's go over this. This is how the laser works. Remember, it is a non-thermal, low-level laser therapy. Non-thermal, low-level lasers therapy. It's based on photochemical physics. The idea is that light goes in and you get a chemical reaction. Essentially, we're releasing a whole bunch of photons, not protons, photons. That's okay. That wasn't her. That's pH, guys. Photons. The photons stimulate little cytochromes. Cytochromes are in that cellular respiration. You get electron transfer. You get chromophores. Chromophores are the light-absorbing portion of the cell membrane. Within that light-absorbing portion of the cell membrane, you're going to go through the cell membrane and you're going to stimulate the mitochondria, the powerhouse of the cell. The mitochondria, being the powerhouse of the cell, ultimately is going to stimulate single oxygen production, crossing this bidirectional cell membrane through the mitochondria. Here is the end result of low laser level therapy. Changes in cell membrane permeability, ATP, DNA. So let me do that once more. We send the photons through the laser. They get into the bidirectional cell membrane. That bidirectional cell membrane is able to absorb them through what we call chromophores. Those are the light absorbing portions of the cells and the cell membrane. They stimulate this great cascade ATP oxygenation neurotransmission. You are healing the body from the inside. What an outstanding method to help people. You're healing the body from the inside. So if you will, I just want to tell you what you should tell your patients. Here we go. Photobiostimulation is another way to describe low-level laser therapy. You're getting increased cellular regeneration and increased cellular communication. Cellular regeneration occurs through the increase of ATP. Cellular communication occurs through the ability to communicate through the cell membrane and the nervous system. So a real aside is, if we're increasing ATP in the mitochondria, what part of the ATP, or excuse me, what part of the body is without question imbued with the most amount of mitochondria? The brain. The brain is the number one part that you're going to have a good clinical outcome on because of ATP. Then you look at cardiac muscle, liver, musculoskeletal, and kidney. So when you look at the different body parts, ATP is a critical element for overall healing. With the communication, the body's all interconnected. It's always communicating. So it's communicating once again through the nervous system and through the cell membrane. Laser is mimicking what we can do on our own, but exponentially increasing it. So I wanted to go through that so everybody here understands once again what it does and what to tell your patients. We're now going to move both the phone and the laptop, Jay, and we're going to go through my office and we're going to do some hands-on. So let's go, guys. Here we go. The whole team is going. So here we go through the hallway. Got my little natural pharmacy. Here's my hallway. Oop, oop, oop. And let's come in here. And here we go. So let's set you up right here. Perfect. Outstanding. And we'll put the phone there. You may want to get out of the way. And here we go. So let me take a seat here. Do you want to move that in there and you move there? So they're both together because you're getting me at different ends. Fabulous. So the first one we want to talk about is the Accelerate. It's one of my favorites, if not my favorite. I love these handhelds. That goes right in my hand. It's, without question, less than a pound. It's the size of my cell phone. And some of the things that I like, the little intricacies of that, what it can do is, so here you have your two laser diodes right in there, and they move at a 20-degree angle. So if I were to turn it on and go right here, there you have it nice and straight. Let me do the 20-degree angle. It changes. So it's always able to change where you go. It also has something called the light emitting diode. So you see I can cover more surface area if I want to cover more of my quad or go right on there. It goes through a little soft sheet of clothes, as you can clearly see. And I can tell you that it is without question so easy to hold. This has 3 FDA clearances. There's 20 pre-programmed, so you should be able to cover virtually everything you see in your office, or if patients are watching right now, anything that you have, it's pre-programmed. You don't feel it. It's low-level laser. It's non-thermal, so you should be able not to feel it, but you'll see the results. So this is the Accelerate, one of my favorites. Great little choice in laser therapy. In addition, we also want to talk about the PL Touch. And yes, I'm holding a PL Touch in my hand. The PL Touch is without question the workhorse of the Echonia low-level laser. It has 2 heads. So I'm going to show you some different kind of takeaways where you can split the heads and do some different things. And this is really light. It's just slightly over a pound. This was the original configuration with the 2 heads. The Accelerate has been the more advanced one where we brought it in, has FDA clearances, musculoskeletal. So what I'm going to do is I'm going to bring in a patient and I'm going to go through upper body muscle testing, something that's a true standard, and then we'll do some lower body muscle testing. I'll show you some Q protocols. We already have a whole bunch of questions, right? We're already getting questions on Facebook. I can see that, and I know we have some other questions, so we'll get right to it. Steph, if you don't mind, everybody drum roll for Stephanie. Come on in.
Where do you want me?
Sit over here, and I will get behind you. So whatever I do with my Accelerate, I don't want to strangle you. Just move my mic cord, thanks. Whatever I do with my Accelerate, I'm then going to go back and do it one more time with my PL Touch. So here's your standard muscle testing. So if you will, you know what? I'm just going to put you down a little bit. So we start with flexion and extension. So real easy. Just flex your head forward. Fabulous. Wow, she works in my office. I think she needs to get treated. Goodness gracious. Come back. You know what are you okay?
Yes.
Is this why you took the day off yesterday?
What's wrong? Just kidding.
So anyway, can everybody just do that again? Drop your head forward, flex. Yeah. So her flexion is kind of poor. And do extension. I know it's a little hard to see. Her extension is poor also. So just turn. Can you turn to the side? Yeah, can you turn this way? I didn't realize this. It's always great to go live in webinars and Facebook Live because you find things. Drop your head forward. Okay, so she's right here. Drop your head back. So let's fix her. The heck with it. Let's fix her. So we're going to come right in the front, and I'm going to just laser. And I'm going to come back in here, and I'm going to laser the back of her neck. I didn't even do the muscle test. Would you be so kind to just drop your head forward? Ethan, I'm sure you got your jumping up and down right now. Drop your head back. Oh, wow. Do you see the difference?
I mean, no, I didn't. I wasn't paying attention.
She wasn't paying the attention.
I can't see the difference.
But my staff's looking and didn't know. You're an issue, girl. So flip back this way. So C1, C2 is flexion and extension. So lateral flexion is C3. So just drop your ear to your shoulder. Okay? So everybody look. Drop your ear to your shoulder here. All right? So let's go right on C3. Right up in here. Now I like to cheat a little bit. And what by cheating is I like it to press against me. And I'm able to do this with my hand. Relax. Get it to contract and relax the muscle. It really helps with muscle contraction. And when I'm able to do that, the beauty of it is because the Accelerate is I'm only holding it in one hand. So that's one of the advantages. Can you laterally flex your head to the right? And I think you can see a little bit of a change. Laterally flex to the left. And that's a change now. Come right back up. Rotate this way. Fabulous. Rotate it to the left. So rotation. So then we would go into what we call C4. And C4. And I just showed you how to do that. Let's do C5. These are always great. So I'm going to put my hand right above her elbow. Press up. And she's pretty strong. Press up. And she's pretty strong. You need to lift more weights.
I know.
Press. Okay, let's try this side. Press up. Okay, so everybody saw how hard I pressed. So with the accelerate, I'm going to get right in the deltoid area. And after muscle testing, and let's get her up, press up. And I think you can see it, there's a little bit of a, hold that up, young lady. Getting a little stronger. And C5 goes right in there. Press up. Mimi, is it all right if I use you or no?
No.
Okay. So that's C5. C6 and 7, you got a bicep, just curl up with the big guns. Woof. Arnold. Let's go. So that's C6. I would laser. I'll make it a little faster, guys. I would laser right in the bicep area. Press down. So that's triceps, C7, and then we're trying to open up her hands. But I want to show you guys a couple little tricks. You just bought it. You can go through the muscle tests, and it's what we call upregulation. Here's what I really like to do. The accelerate allows me to go right in the brachial plexus area, right in between the two scalenes. And here I go. So I like to laser for any upper body thing at the very end, right in between the scalenes, and try and get that brachial plexus. Now, Steph, if you would press up and push. And you can really see the distinctive difference in her arm. So up here, still not quite as strong. So you're seeing a great action potential by me working on the brachial plexus right up in here. And press up. And you can see the difference. So that's my little trick with the accelerate. As good as it does with the muscles, when you're able to get all the nerves, which you can get by going to each side of the brachial plexus, you're going to have a panacea of strength. So that's the accelerate on the upper body. Let's do the PL touch. So here's a couple of different tricks with the PL touch. Traditionally, wonderfully done, the PL touch, you split. You go to the spinal cord and the nerve root. So clearly C1, C2, what I'd like to do is I'd like to pin them both together, C1, C2, C3. When we get to C5, I go here and here. So C5, we would do that. Let me turn it on. And you split, excuse me, and you split the heads. So you're right on the spine. C6, we're going right to the spine, go right here. C7, so I'm just moving the spot, can everybody see? In the spine, and C8. Now, here's the beauty of the PL touch. You got the split of the heads. You got two heads. You got laser diodes. You've got 4 extra frequencies coming out. So what you can do is you can split them, which I like. You can also put them together. Now, where it really works is when we do brain work. So if I want to do the brain and make her smart, and here we go. You're supposed to laugh. And switch around and go. So when we differentiate the two in the upper body, this is easy for me to hold. It fits right in. Everything's on one hand. And this beauty is you get the split. You get the split of heads. Now, also you get 40, believe it or not, stored frequency patterns, protocols. I don't know anybody who needs more than 40. You get 20 here. So there's a great differentiation in the upper body. Let's go to lower body. Let me show you some hands-on, and then let me show you some really neat protocols. I just gave you one. So I just gave you one protocol where you can get up in the brachial plexus. You don't mind lying on your back, do you? I'm going to raise it up a little bit. How are we doing there? Can everybody see? She's nice and comfy. You comfortable? Everything's good. So we can go through the different L1, L2. So one of the bigger ones I like to do is the psoas. Please press up. And of course, boy, no one's going to believe you work in a chiropractor's office. They're going to think I'm the worst chiropractor. Did you guys and gals see that? Press up. Yeah, it's a little better. Thank you. Okay. Goodness. Here's the iliacus. Press up. All right. So what I'd like to do with the psoas, let's go right to the accelerate, is get right in here. Sorry. And just go right into the psoas and press up. And bingo. I turned her psoas on. Iliacus goes right there. Press up. Outstanding. Let's test the quadriceps. Press up. And then you get the quadricep in this manner. So I'm trying to do a little quicker for everybody here. Hamstring. Pull down on the hamstring. Go ahead, pull. Oh, look at you. You're getting a little strong now. We get L4 where I can work the feet. So there's a ton of different things to do with the muscle tests in the lower body. Same way with the PL Touch. The only difference, once again, what I like about the PL Touch is I go right to the cord and then I hit the different nerve root areas. So I could flip her over, go to her spine. So I get the nerve root here. You could sit. Could you sit and face them, please? Goodness. So I'm hitting her spine, and then I can get her quadricep. I'm hitting her spine, and I can get her L4. I can get her psoas. I'm hitting her spine. Before I work through the front, now I'm doing the back, so I can, again, split them. So you're seeing some of the differentiation. Do we have any questions? Because let me grab some questions.
Yep, there are a few.
You wrote a few? Do they have any up on there? No? Hey, E, let me take a look. Let me see if they have any questions, because I see some people blowing up. Nope, I got these three that they wrote down, so forth. So let me go over a few of these, and we'll do some treatments, and let's see what we have. Here's 3 questions that they took off Facebook Live, which we're on right now. How has it helped your clinical outcomes? Man, what a great question. It has increased my clinical outcomes so much exponentially. I do a lot of ART, I do a lot of factor, I do instrument assisted, I do taping, I do a lot of rehab. It has increased my clinical outcomes, as I said, exponentially. It saves my hands. You know, a lot of the work, you know, Steffi's small and petite. Some of the people that came in, and it was a very sports-oriented practice. They were very big. It got hard to lift the legs. It got hard to move their arms. And it really helped. It saved my elbows, my back, my shoulder, and the like. The clinical outcomes, my whole goal was always to get people better quicker. And, you know, there's always that fear that if you get people better quicker, they'll leave. But if they leave, they're telling so many people about it. There's prevention, wellness, and performance within the laser that I'd be very happy to talk about in this webinar if somebody asks me some questions for. So I could not practice at the level that I try to practice without the laser. I will not give it up. I have a laser in my house. Maybe I shouldn't have said that, because maybe he's looking at me really funny right now. We have every laser that Erchonia makes in the office. So we are a full healthcare laser center combined with the nutrition and the functional movement and the sports. The other question was, give me your 5 top protocols. Well, I'll tell you what, I'll give you a minimum of 5. I may even go into 10. So take this down. Number 1, clearly lower back. How do you not, 8 out of 10 Americans have lower back pain. It's the 4th biggest chronic disease that we face. It's ever growing. And with the Lancet coming out on March 21st and speaking to the concept of MRIs really aren't indicative of the injury, and the pain sensor, everybody's very pain oriented. People want to get fixed. So lower back pain is number 1. Number 2, why not just neck pain and headaches? So you got 2 and 3 right there. Rotator cuff is a tremendous one. Rotator cuff, frozen shoulder, I'll put those together. I see an awful lot of that. I see great outcomes. Anybody who needs any literature on any of that, I'm very happy. Ephraim's on the on the phone over there with the webinar. We got another question, and he'll get you the info. I'll get you the info. So lower back, neck, shoulder, a lot of tennis elbow, carpal tunnel, ankle sprain, hip. What do you got?
Is it better to laser on skin versus clothes?
Is it better to laser on skin versus clothes? It's always better to laser on skin versus clothes. However, she's doing a very small shirt. It's not a major problem. There is a little scatter. We get 45 billion photons coming through. So even if we got a 90% scatter, we only need 1. So that gets to the point of the power of 1. The laser really works with the power of 1, meaning it works because as long as 1 photon gets in and gets absorbed, it sends that cellular cascade. And that cellular cascade starts that healing process, ATP oxygenation and neurotransmission. Better on the skin. Stuff like this is fine. I wouldn't put them in a full Navy SEAL vest and try and work through it. There's been some people that have told me they've gone through casts. But better on skin, good enough through the shirt.
Once you get them into wellness, how does the tool need to be utilized?
So that's a great question. Once you get to wellness, how does the tool need to be utilized? So what you basically saw me do was upper body upregulation. We call upregulation strengthening all the different muscles. So by strengthening all the different muscles, that's a great wellness protocol. So I do everything from C1 through C8 up top, and L1 through S1 in the lower body. Also, for me, wellness is movement. So I didn't do it here, but I'll have somebody squat and laser them while they squat. I'll have people get lasered while they move. I go to gyms and I'll laser them while they perform their activity. I have a stand-up table in the other room, and I'll laser them as they go from a seated to a standing position. So I'm a big believer in practice the way you play, the upregulation, and one of the bigger takeaways, and I'm going to pause, I know you have a whole bunch of questions, I'm big on lasering the brain. So I do a lot of concussion work. I use my FX635 a lot. That's in the other room. But for the handhelds which you purchased, I laser the brain. I'm happy Ephraim's got it to share my concussion protocol. I'm lecturing all over the world on concussion, and a large part of what I do to help with concussion and prevention and wellness of the injury is laser the brain. I have a nutrition protocol and a rehab protocol. Do you have another question there? Okay, so let's go back to this. Probably the most common question is, can you combine it with other chiropractic treatments? And the question is, yes. So they usually say, do you laser first or you adjust first? Either or is fine, but it works synergistically. There's multiple articles that talk about There's a plethora of articles that talk about cervical adjustment being so effective. There's a ton of articles that's talking about laser being effective. When you combine the two, they're even more effective. Same thing with lower back. So it's very synergistic. I do it in a rehab setting. I do it with soft tissue. So you're going to get a better clinical outcome if you combine those two. Do you have any other questions? There was one more question about charging and everything like that. And each state for chiropractors is different. Before we close, we have a marketing expert, Ephraim Villa, is there. And I want him to address that and really speak to that. But doctors do charge for it. Doctors should charge for it. Depending on where you are, it's going to be a different price, but I'm going to let Ephraim talk you through that. And, without question, my suggestion is, before we do one or two takeaways with Steffi, let everybody know all about the laser, what it does.
Great job, Rob.
Hold on, we got another question. Go.
How many treatments do you recommend for chronic conditions?
Chronic conditions. You know what, in Ephraim, it's a great question. It's going to take me a minute to answer. So many times I'm asked the question of, and we don't do it enough, as a speaker. We don't do it enough. We talk about acute versus chronic and how long. Great question. So obviously acute's going to be a much quicker situation than someone coming up with chronic discomfort. We're going to change the frequencies according to that. A chronic lower back condition, whatever you were treating before, you're probably going to do it in 50 to 60% of the time less. So for me, chronic lower back, you're looking at 8 to 12 visits. You're looking at acute lower back, even less. I'm a big 6 to 8 visit guy. I tell them 50% better. I always like to under-promise and over-deliver. I'm a strong believer in telling patients, you have to understand and manage personalities, and you also have to manage expectations. But chronic's going to be different. It'll be a little longer. There's something called a laser shower. So what you guys saw me do was upregulate. There are stands. Ethan can talk about the stand in a bit, where you hold. For a chronic condition, I like what we call a laser shower, maybe a 12 to 15 minute time frame, where they're getting showered, so it gives their body a longer time to absorb. The key to the laser isn't just acute and chronic, it's how healthy their cell membrane is. And that's a good conversation on why they need to take fish oils and things like that. Do we have another question there? No, we're good? We're going to bring you in, anything? Because if we are, I'm going to sign off on Facebook.
No problem, I'm in.
Okay, I'm going to sign off. Hey everybody, Dr. Rob, always yours in health. Please like, click, and share this. Hope to see you next week.